Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my January CEO Connection. I'm really pleased today to have my guest Woody Castleberry, and Woody just recently retired from the hospital after having worked here, what, about 5 years? 5 years?
5.5.
5 years?
Mm-hmm.
I first got to know Woody back in 1990 when I interviewed for the job as the CEO, and Woody was on the board back then and has served in different capacities as part of the board, being treasurer and then chairman of the board from 1996 to the year 2000. And over that period of time, Woody, I can't tell you how important you've been to White River Health System, and to me personally, I owe a great deal of gratitude to you, and I sure appreciate everything you've done for us. And I'd like to kind of hear sort of your take over the last 25 years in the system, and what stands out in your mind?
Well, first of all, I want to thank you personally for the opportunity to work here for the last 5.5 years. I really got to see another side. As you know, I knew a lot about the hospital from a fairly high elevation, but I didn't know anything down at the ground level, and so it was really interesting to see that and what this facility has done, how it's grown, and the services it offers, and the people it employs, the providers we've recruited in here. It's really remarkable. And in my past life, you know, that the economic impact that something like that would really be important to me, as it should to everyone. But the care it provides to the people within 50 miles of any direction of White River is, of course, needed and important. So it was gratifying to be a small part of that. I was glad to be involved, and it was really interesting and rewarding to watch it grow.
Well, Woody, you know, we've had a good run, and frankly, I think I'm as excited right now about the future as I have in reflecting on the past. I think with the residency program coming on and the expansion of our locations and services, I really feel good about the future.
Yeah, I do too. You know, the role I played here recently in working in population health and that sort of thing, it became really obvious that physician involvement was going to be critical, and it would really be advantageous if those physicians were employed. It just makes it so much more seamless, and as it's happened over the last year and a half or two, a huge percentage of our local physicians have become employed, and I think that's really going to serve us well in the future.
Yeah, there's no doubt. You know, it seems like as doctors have become employed, we've gotten more of a teamwork approach, and
Exactly.
Everybody working towards the same goals and making the system stronger, and that's beneficial to everyone.
That's the only way we're going to be successful in population health.
Yeah.
We all have to work together.
Yeah. Do you have any plans in retirement? What are you going to do besides fish and play golf and raise grandkids?
Take care of grandkids. After the first of the year, I'm going to look to do something part-time, maybe 2 or 3 days a week. I haven't talked to anybody. I'm going to wait till after the holidays to even put out some feelers. But other than that, I don't have one bit of trouble staying busy. I've just got a lot of chores I'm always looking to do, and we live out in the country, so there's trees to trim, lawns to mow, and between that and the kids and my hobbies, I won't have any trouble staying busy at all.
You know, Woody, you've been such a great part of this health system. I can't imagine you not being here on a regular basis, and I know personally you've sure provided me a lot of guidance over the years. You know, I think you've steered me in the right directions, and I can't tell you how much I appreciate that, and look forward to seeing you in and around Batesville, and I hope you'll come by the hospital and keep us updated on how things are going for you.
For sure. Thanks for having me.
Thank you, Woody. We have 2 excellent employees of the month that I want to recognize today. At Stone County Medical Center, Catherine Hayes, a patient care tech, has been selected. She's worked at Stone County for about a year, and she takes great pride in doing her job. So if you see Catherine, be sure to congratulate her on her recognition. At White River Medical Center, Reva Wells, an RN on the 3rd floor Central, has been recognized for demeanor. She's been at White River Medical Center since 2009, and like Catherine, be sure to congratulate Reva on her recognition. On January 5th, our Sugarloaf Medical Clinic in Heber Springs will open for business. Susanna Blackburn, an APRN, will be the nurse practitioner at that location. And I visited the site yesterday, and boy, it's really going to be terrific. We're going to do an open house at that location on January 27th at 10 o'clock a.m. And so if you're up and around at that time, I'll be sure to stop in and participate in the festivities. Dr. Shannon Swift and Ian Parker will be starting accepting patients this month at the Southside Medical Clinic. An open house for that facility will be January 31st at 10 o'clock a.m. If you have driven by the new location across from the airport, it's really impressive, and I know that we're really going to do great work at that location. So if you're available, stop by and see the clinic, and for sure to come by at the open house on January 31st. On January 10th, we'll have our community health education event with Shannon Swift talking about adult immunizations. It's at noon at the Josephine Ray Rogers Community Center, and so if you're available that day, come by and hear Dr. Swift's talk on adult immunization. In November, we distributed bonus checks to employees of White Bear Health System. One component of the bonus checks was patient satisfaction survey results. During this month, I'd like to have all the departments give some thought to those things that they could participate in improving patient satisfaction. And as I've thought through it myself, some departments may want to talk about what do we do to improve patients' privacy? What do we do at the hospital to decrease the risk of infection? What do we do at the hospital to make sure the food is warm? What do we do to improve the appearance of the hospital? I think that each department can play a significant role in patient satisfaction. And at your department meetings, I'd like to have you spend some time dialoguing amongst yourselves, doing some brainstorming, and think about what questions that lead into the patient satisfaction surveys that by each of us taking a role in it, that we could improve it. So this is somewhat unique, and I think each department has their own skill sets and their own ways to interact with patients or guests or visitors that can have a significant effect on our patient satisfaction. So as that was a part of our bonus this last year, it will be a part of our bonus calculation for next year. And so if we all take an active role right now as the new year begins, I really feel comfortable that we can have those bonus checks again in 2017. So take that upon yourselves and let's see what we can do together. This concludes my CEO Connection for this month. Again, if you have any suggestion how we can improve it, I'd be certainly welcome to hear that. And so thanks for watching.